I'm just so happy I'm in my bedroom doing this video. It's very exciting for me to be home. We love our house and our home in Yarmouth, so I just had to say that. Good morning, everyone. Millie's sleeping, so I'm going to whisper. And at that, I woke her up. Shit. We are home, and it feels amazing. Kidney stones passed naturally, thank God. And we get a week at home before we have to return to sick kids. And it makes a huge difference for our mental health, I would say, to be able to come home and be a family and feel normal for a little while. I'm gonna do a really quick video update today. So this video is going to be about enoxaparin shots, which are a huge reality for many heart parents, and for a lot of parents actually, because these are used as a treatment for a number of different illnesses. Okay, so what's enoxaparin? Enoxaparin is a blood thinner. It's also called Love Knox. And it is used when children have stents in their hearts. And the point of it is to thin the blood so that it doesn't create blood clots within the stents, which would make them not work anymore or cause some real issues. It's also used, I think, sometimes after cath procedures. If they go through the arteries in their legs, it can cause blood clots. So not for long-term use, but I think they use it in the hospital sometimes for that reason. Millie's had a couple blood clots in her legs from central lines and from cath procedures, which is part of why we were put on blood thinners. In addition to her enoxaparin shots, Millie also takes aspirin every day, baby aspirin. So her blood is very, very thin, and that's the way it needs to be for her to be safe. Unfortunately, one of the realities for parents whose children are on blood thinners is that you have to be extremely careful because they're not like other kids. It takes a while to get the blood thinner out of their blood. So if you were in a car accident, they needed emergency surgery, it could be really bad for them. It's important that you have some kind of identification for if you're not able to speak for your child, so that emergency personnel know that your child is on a blood thinner. So, it's very poor camera work. Last night we had a scare with Millie. She's learning how to walk, which is really exciting, but as many parents know, means falling. And because she's on blood thinners, that can be really scary for us. So last night she was holding on to the ottoman in my living room. Maybe I will just take you and show you where she was. So she was holding on to the ottoman, standing up, which was very exciting for her, except it has a spin top, which is pretty sturdy. You can use it for storage. And what she did was it spun a little bit and she fell. And I was sitting right here on the couch, which is like right next to it. I was right by her, and she started to fall, and I jumped and went to catch her, and my hands got there, but not before her head did. Head hit the floor. She landed on the rug. We have hardwood floors, which are great when you have dogs and babies because they're easy to clean. Not so great when your child's on enoxaparin shots and aspirin, and their blood is thin and they're learning to walk. But she's okay. I guess I should have started with that. Millie was okay. We asked the doctors. Derek and I were quite concerned about what to look for because we knew it was going to happen. She was going to hurt herself. She might hit her head. And they told us that you look for concussion kind of symptoms. So if they hit their head and it bounces and they don't cry right away, they're kind of shocked. If they're not themselves, if they're throwing up, if they're not willing to drink, if they're very fussy, those kind of things, because unfortunately they can't tell you, they're babies. Those are the kind of things you look for. So Millie cried right away. She settled pretty easily. We gave her a cookie. She was super happy about that. We watched some Wiggles, and she's been absolutely fine. Millie is part of the EHS Special Patient project or program, where she is registered with very specific information about her heart condition, what we as a family wish for her, and it includes information about her medications, such as her blood thinners. This might be another topic that I can cover another day if people are interested, but Millie was first registered through the EHS program because we didn't want her resuscitated. We came home on palliative care, and we were under the we were given the information that if Millie were to go under cardiac arrest, that there would be nothing more they could do. While emergency personnel could revive her, it most likely would be that we would have to make a very hard decision later on about stopping life support. So that's why she's part of that program now, although those orders have changed. We have been told, and it was a very, very happy day when we were told this by our cardiologist, that there is now something they could do, and that it is important to get Millie to the proper emergency personnel if there is an issue, and that they hopefully would be able to help her at Sick Kids. So Millie has a lot of bruises. She gets Enox shots twice a day, and they are administered by mom and dad, which was really hard for me the first time I was told that I would have to do that. We're playing maracas today. Maraca. So we try to do it in the fleshy part on her leg where it's fat, and it hurts less. I've heard from adults that when the dose goes in, it actually does sting, and the bruises can be quite sore. She also gets kind of hard lumps under her skin that we need to massage out, and we can't inject in those areas. If we hold pressure for a long time, that's supposed to help with the bruising, but we can't inject in bruises. So unfortunately for Millie, we've had to move on to there's Abby. We had to move on to doing shots in her arms as well as her legs. We do right at night and left in the morning. That's how we remember, and we alternate between legs and arms. Mom loves you. You know, Millie doesn't even seem to notice anymore when we do it. We distract her, we pinch. Mom and Dad have gotten good at giving it, and I think it's harder on us than it is for her. We draw up the Enoch shots. They're in little diabetic needles ourselves. We have to make sure the process is very sterile. We use alcohol swabs. We do it twice a day. Derek does them a lot because it was really hard for me to do it, and it still is. One of the first times we came home, I was administering an enoxaparin shot to Millie in the morning, and she jumped, and then I jumped, and I stabbed her twice. It went in twice, and I actually scratched in between her legs, and there was a horrible, horrible bruise, and it was pretty traumatic for me. I had a really hard time giving them again after that. Millie got over it pretty quickly, but I could see the bruise on her and know that I was the one who did that to my baby, and it was horrible. I know, it was hard for Mama. And my mom, my amazing mother, who actually has diabetes and she's lost a lot of weight, and she doesn't have to anymore, which I'm really proud of, but she used to have to give herself insulin injections, so she is experienced with the process and knows how it works. Oh, good clapping. You clapping for Nanny. Nanny lost all the weight. She's so healthy now. She's done good. She takes care of herself. And she looks beautiful. Yeah, Nanny. she actually stepped up and would do some of the enoxaparin shots for me. This was when we were living with them when we first came home, until I was comfortable enough to do it again. And I can't even explain to you what that meant to me, that she was able to do that for me, because I know that a lot of heart parents, they don't have anybody that they can rely on. Nobody is willing to learn how to use an NG tube, how to give enoxaparin injections, or draw up and administer meds, and the toll falls to the parents. And I see sometimes on chat rooms where or parent support groups where even it falls to just one parent. Another parent isn't comfortable enough to do it, and one parent holds all of that burden. So I feel really blessed that I have a husband who has really taken on this role and to help and is willing to do the hard things. Oh my god, he even learned how to put in an NG tube. But care by parent is a requirement before you take your Heart Warrior home. Parents have to, for a 48-hour period, do everything for their child, to draw up all the meds, take care of them, and prove that we're able to do it when we go home. And it's a real support system, because it's hard. You want to go home so bad, and then you get home and it is a huge adjustment. It is scary, and in some cases your child has been in critical care their whole life and you don't even know how to feed them or change their diaper properly. That sounds ridiculous, but you don't know what bum cream to use because it was all what they used in the hospital and nurses did it for you. So Derek and I actually did our best to be as hands-on as we could in the hospital so this didn't happen. But when we did care by parent, my mother actually did it as well, and learned it all, so that when we moved in with them, she was able to help. And we did live with my parents for a little while before we got to come home, because they lived closer to our children's hospital and we were just more comfortable set up there, because we had the support that they provided, which we are just incredibly lucky to have had that opportunity and to still have. So it's 9 o'clock, which is when we give Millie her enoxaparin shots. This is our Millie cupboard, which is where we keep all of our medical supplies for Millie. So to draw up her Enox, I need an alcohol swab. The enoxaparin, a Band-Aid, and cotton balls to hold pressure. We use these ultra-fine tip insulin syringes. Yes, Millie. Hi, thank you for your wave. The first thing we do is we take the enoxaparin bottle and we do an alcohol swab on the top to get rid of any germs, and we have to wait a second to make sure that that kills everything. We take our insulin syringe and we just poke it through the top here and hold the bottle upside down. Millie takes 7 mics, so we very carefully measure it and get the bubbles, air bubbles out. Yeah, Mel. We put the cap back on because I have stuck myself in the past. And we got our cotton balls ready. So that is that, it's ready to go. Okay, so these are Millie's 9 o'clock meds. We're gonna do the injection shot first. We've got our wiggles on for distraction. We've got our arm out. Today we're doing arms and it's night, so we're gonna do the right side. You wave, Millie? Where's the camera? Good job. Okay, bug. So I even got your bottle, so maybe that'll keep you busy. You'll just hold that, Millie. Thank you. Okay, so what you do is you pinch the fatty area on her arm. Uh-oh. We inject. Okay, so that's gone better in the past. But Millie's had her shot. Now we are going to hold pressure with the cotton ball, and we do this for a long time, and then we put a Band-Aid on. Can you show off your Band-Aid? Band-Aid.